So in this video, we're going to go over some of my skills and what I did for charity. So I used to work with a Raymond, a David, another David, a Joanna, and a Chris. These people were all either elderly or disabled. Chris was missing a leg. Joanna used to smell like cat piss, but she had no cat. Her apartment was a mess. I used to have to clean, do dishes, clean her clothes for her, help her with her son. Me and Kenny were the only two people allowed to even sleep over when she asked, according to her son. Nobody was allowed to stay but me, but Kenny was allowed to stay as well. Anyways, because these people, I had a rule. They have to ask me to stay overnight. They would say, "Where are you going tonight?" And I would say, "Oh, don't worry about that. I got a place to go." "Really? Where?" "No, I really don't. I have a tent or a building I built." And they go, "Well, I want you to stay here." And I go, "Okay." But you have to have them want you to stay there. If you ask somebody else to stay with them, it becomes a problem. But if they ask you to stay with them, it's always a pleasure. That's why I make sure to have close people near me who ask me to stay with them. It's one of my rules. Anyway, so I worked with these people. I still work with one of the Davids who's 84. He has a past sex offense. He's senile. He goes nuts. And he's actually very dangerous too, something I didn't realize when I continued giving him care. There was a Raymond. He has the intelligence of a 7-year-old, but he's a 50-year-old. And even though he's marked mentally disabled, and he used to be marked, retarded. I don't like that word, but that tells you his level. He is retarded. As in the 1980s, what you would call retarded is him. I'm not being mean. That is his class. That is his disability. He is mentally retarded. I know there's other terms like mentally disabled, but there's a lot of mental disabilities out there. There's a lot of illnesses. This is definitely retardation. So anyway, so this man is very, very difficult. One of the most difficult cases, so difficult that all his workers has given up. His mother gave up, his brothers, his family, everybody, his own father, everybody gave up on this person. Why? Because he likes to try to get you arrested. Now, these are very clear, very bullshit type things. He wants attention and he likes to make up stories. He likes to do it with the bank. He'll say that somebody stole his checkbook just so he can call the bank back every day. And when he wants attention with a homeless person, he'll tell another homeless person that that person stole their debit card. He did it with Justin and Spasian. Spasian was about to kill Justin. Justin didn't know why. Literally about to kill him. And the whole thing, I brought both of them to Raymond. I said, "Well, if Raymond told you this, it was probably bullshit." He goes, "Why would Raymond bullshit me?" I said, "Because that's how Raymond is." "Have you stayed with Raymond before?" Because you know Raymond has me throw everybody out once a week, right? You know that. I live down the street in a different apartment, and Raymond calls my home phone, has me come over and throw everybody out because the police won't do it for him anymore. "Are you aware of this?" "No, I just spent one night." "Oh, so you don't know Raymond really well." "No, I don't." Well, Spasian or China, or they both, I think it actually was China. No, it wasn't Spasian, it was China, who was actually a white guy. China, you shouldn't beat up, who actually dated one of my exes, by the way. But anyways, China, why are you going to beat this guy up for something you heard? Let's go make sure it's true. So I say, hey, Raymond, I need to talk to you. Come down. So Raymond comes down. I say, "What's this right here?" And then Raymond gets scared because he lied and he's in trouble. You could see the scared child look on his face. And I go, "Did you tell him that he stole your debit card?" And he goes, "I never said that." And then China gets all big because he's a big guy. Goes, "What? How dare you? You calling me a liar?" And then Raymond gets very, very scared. Eventually, Raymond says, "Oh, well, I didn't mean it." So it all gets dropped and put away. But Raymond does this all the time. He does it with his workers. When his workers come in, he says right when they leave, he calls the agency and says, "My worker hit me. My worker hit me." So they give him a new worker. Then he calls the agency and says, "My worker hit me. My worker hit me." Then they gets a new agent worker and he says, "My worker hit me. My worker hit me." So these agencies don't work with him well, and they don't give him the care he needs. They never did. But I come along, and all of a sudden, he's now got surgery. Yes, his workers allowed his guts to be into his testicles. He literally had to get hernia surgery because his hernia broke open and started to go into his crotch, and he was so overweight that his crotch started to overhang like his belly when he was standing up close to his knees. It was disgusting. When he was naked, you could see this hanging towards his knees. And I literally just knocked on the door to take a shower, got a quick glimpse of something disgusting that I wasn't sure what it was. So I asked him, I said, "Is there something wrong where your guts are hanging low?" He goes, "I don't know. Will you take a look?" I said, "I really don't want to take a look at your privates, man, but I will." So he dropped his pants, and I was disgusted. I wanted to vomit in a trash can and knew I had to bring him to the emergency room. I brought him straight to the emergency room because I knew he had some type of hernia. And yes, he had a hernia where he had it for so long, so many years, that it just kept on hanging lower and lower. And he is so mental that he doesn't feel pain. He's had cuts, bruises, falls. He's had multiple things that should have hurt, like abscesses from being dirty or the hernia I mentioned. Both of those I had to bring him into the hospital for. I had to bring him in the hospital for having a big dirty abscess because he didn't clean himself often enough. And I had to bring him in the hospital from putting all that olive oil and cooking oil on himself. Anyways, but I also had to bring him to the hospital for a hernia. So his workers let this man almost die of a perfectly preventable disease. Kind of like my father keeps on letting me get hurt or die from stuff that's perfectly preventable, all because he doesn't want to tell the truth or let any of my doctors know that what I'm telling them is true. So I got nobody backing me up, so they just keep on malpracticing me and going along with my mother's fantasies and giving me medical care based upon my mother and father. What basically mean drug the shit out of him and don't listen to the patient ever. That's my mother's medical treatment. I'm psycho, I'm crazy, and I should never receive medical care. Anyways, back to the people I help. So, Raymond Christian III, his workers, and the people he worked with let him sit in pain, or he said he didn't really feel it, but he must have really felt that he just didn't want to talk about it, and have his literal guts fall down into his testicles or in his crotch area, and then after years of being there, just hang lower and lower and lower. I didn't even know somebody could survive with their intestines that low into their crotch. I didn't know that that was possible. I didn't know that you could have your intestines and your guts down into your balls and in your crotch area and all in that area hanging so low. I didn't know that you could survive that. But anyways, I got him to the emergency room and they threw it all back high up and they gave him the surgery he needed. I also made sure that this man was shaved because he used to just do like a half a shave. He would give like one strip on the side of his face. So half of his face would look like a beard and the other half would have little patches missing. So he would look like some weirdo. But I would help him and teach him how to at least do a full amount. So that way it's even on both sides. I taught him it was even. Then when he was getting thrown out of his apartment, because I moved up to New Hampshire and he let everybody into his apartment, he already was getting into trouble for this type of stuff. And I was working with his management. I had $2,000 knocked off because he flooded 3 floors because he didn't have a plunger and he decided to flush the toilet for a week because it was clogged. Also, he had a lot of people staying there that I worked with his management saying that if I would check up once a week and I would throw out anybody I saw that once a week trip. Anyways, he got thrown out of his apartment while I was up here. So I let him move up here temporarily. I said, "You can't live with me for long. I will give you less than 2 years. I will give you a couple, it's supposed to be like 6 months until you can get into assisted living up here. I will file the paperwork. I'll get you into some type of home with lots of people that you can hang out with, and that's what I'll do." Now, he didn't want that. He had it too good with me. Same thing with my roommate now. I treat them way too good. I do everything for them. I clean on my hands and knees, clean up their feces. I cleaned up Raymond's olive oil mess in the tub. He decided to take a bath with olive and vegetable oil. It took me frickin' a week to clean that up. I'm always cleaning the cats, their messes, and I make it easy on them. I don't ask them to do anything. I clean their rooms for them. They have it so good that why would you ever want to go anywhere else? But it's so moldy in here they can't breathe. That's the only thing. So I don't want them to stay long because they're saying they're having breathing difficulties from the air in here. Raymond's opening up all the windows and turning the heat on 90 in his room. He has 3 windows in the smallest room in the house, about the size of a bathroom. He opens all 3. It's the only room where there's so many windows side by side. All these windows are jumbled up in this room. There's literally 3, and this room is small. But he opens up all the windows, so basically now the whole room is made of windows open. It's literally just an open room now. And he has the heat blasted, and because it's such a small room with 3 windows, the heat's not going to work. So it's going straight out. So I yell at him. I raise my voice and say, Raymond, I told you, no heat with the windows open in here. If you have a window cracked, maybe. But look at that heater. That heater is right below those 2 windows. If you have both those wide open, the heat's not going to work. Well, I'm cold. Then close the windows. Well, then I have problems breathing from the air in here. There's nothing wrong with the air, Raymond, I told him. And then I walked away. This was the first year we were here. I found out 2-3 years in that the mold is severe and there is something severely wrong with the air. It is really bad, and the only reason why I didn't feel it right away is my lungs were ruined by weed and cigarettes. So I have a little more tolerance for things in my lungs. But Raymond never smoked, so he could feel it right away that something was wrong with all the mold in the air in this apartment. And I was a jerk. I was an asshole for telling him to close those windows. I should have let him get all the fresh air he wanted. Anyways, so I give him a shave and I keep him clean too. I clean up his olive oil messes, and we bring him shopping, and we go bring him clothing shopping at Kohl's. We make him keep on to his own money. He wants to go give his money out to the homeless again. I told him, no, this time I'm bringing you clothing shopping, so I do not want you spending your money. And we did. I brought him clothing shopping, and we threw in a couple extra bucks of my own paycheck, and my roommate wanted to throw in some money so we could have some clothing, some razors, some clippers, things like that, which we taught him how to use. Now, he was causing too much trouble, and Raymond wanted to leave, so I told him, we're not holding you hostage, you're allowed to leave. Then he left and come back an hour later and said, I don't want to leave. Then he did this again 2 months later, said he wanted to leave, left, and then 2 hours later came back and said, I don't want to leave. I want to stay with you. And I want him to leave and go into assisted living. He now has the paperwork for assisted living, by the way. So what happens? He refuses to sign because he doesn't want to move out. He has it too good in my apartment. He loves it here. He gets away with everything. So at this point, I start talking to his workers, and I say, Raymond says he wants to leave, and I'm going to let him leave. And if he says it again, I'm going to have to let him leave for good. Raymond does it again, and his workers call me, and they ask, and I tell them, I have a recording of Raymond saying he says he wants to leave, and he left last night again and came back. They say, well, we're going to have him leave for good. I said, okay, as long as you guys take care of him and keep him safe, I don't care. If he wants to leave, let him leave. So he leaves. I pack up all his stuff. I give it all to a worker who drives by. Raymond doesn't even pick up his stuff. Who knows why? He's probably making up stories again or something. Who knows? But one thing I tell his workers is I say, you guys got to be careful of these things. He doesn't shave well. He doesn't know how to clothe himself. He likes to pour olive oil in tubs, and then other people in the program might slip, as well as the storytelling, as you know, can be problematic. They say, we'll take care of Raymond. And then they, don't forget, these people are making fun of my care strategies and the way I give care to these people. Well, now it's my turn. I saw Raymond on the bus for the last 2 years. He's half shaven, wearing blue pajamas with pizza slices with red stains on it, with his fly open on the bus, not wearing underwear so you can see his dick through the flap. Not only this, he has half a shave. He has a white t-shirt on with a bunch of sweat stains under the armpits, and he literally looks like a mess. And when I sat even 2 seats to the left of him and back of him, you could still smell the wrench that he hasn't taken a shower in weeks. So this Raymond is not getting the care he needs. He has only a patch missing on the right side of his face. I know what that is. He's going back to his old habits. He's going back to the old Raymond. He digressed. I spent 6 years working with Raymond, half in Lowell, half in New Hampshire. He started to look better. He started to shave himself. I got him to start doing his own shaving the correct way. I got him to dress himself correctly. And then he goes back to work with the state, and the state allows him to digress again. All you have to do is sit nicely next to the man and do it for him a couple of times, and then he'll do it. The problem is that the state is fake with him. They feed into his bullshit. You have to feed into it a certain way to get results. You have to allow, okay, Raymond, great story. Well, I need you to show me that you can do both sides. Yes, both sides. I don't know why both sides. Because people make fun of you if you don't do both sides. Yes, people will make fun of you and they might steal your stuff. It puts a target on your back when you only have one side. So let's make sure you do both sides. Oh, I didn't know that. I didn't know that people would make fun of me and it puts a target on my back. Yes, people are two-faced out there, so you want to do both sides. But then the state says, do whatever you want. Shave one side. They don't help him. They don't give him classes on how to shave. They don't tell him how to dress. They don't help him with the dressing. They don't tell him why it's a bad idea to wear pajamas with an open flap and no underwear on the bus when you weigh that much and you just had so much the hernia issues. Literally. I guarantee you that some woman's going to scream when she gets on the bus because they see a Raymond penis hanging out at them. All because the state doesn't care to tell this gentleman to wear underwear with his pants and maybe not wear pajamas with no underwear on the bus without the flap buttoned. But this is the state's problem now, not mine. I did my work and it did a good job. When he was living with me, he was showered, shaved, he was fed, he had clean clothing, he was shaving himself by the end, he was clothing himself properly by the end, he was even cleaning up his room a little bit, not really. His room was a smelly mess. I got him the spray, put some deodorizer down on the carpet in his bed. That's the best I could get him to do. But it's more than the state ever got him to do. We cannot the state could never get him to get rid of Mount paper or Mount trash. In his old apartment, he had a Mount trash. I got rid of it for him and he got mad at me. It was a mountain of trash that he just put all in a pile. He had a pile of papers that was up to your knee, and then he had a pile of packaging and trash and wrappers and things like that up to your nipples. This is how Raymond lived. He made piles, giant mountains, and you couldn't even see what was in the middle. This is crazy. This is a crazy type of people. And this was Raymond. And I did my best working with him. He got much better, but now he's regressed back into his old habits because the state is no longer helping him. Because I've now left it to the state. Raymond's not my responsibility and has not been for at least 4 years. I have not had to deal with him for longer than that. And but I still see him. I still talk to him on the bus, and I still worry about him. And it's very clear he's hopping from shelter to different types of apartments that the state gives him, to friends' houses, and then they throw him out and take his money, and all these other problems that the state is very, very warned about. I gave the state a heads up about these things, and then they drove him straight into them. They knew what his problems were, but yet the state decided to drive him straight into the ground with his disabilities. He improved. He was wearing good clothing. He was shaving. He was showering. He was trying to talk normal. He was meeting guests. He was going out to other people's houses to get supper. But now he has half a beard. He's wearing pajamas without the button flapped, with no underwear, so people on the bus can see his penis. He has a yellow shirt with a bunch of stains, and he smells like a barn. As well as he's been moving from place to place because he has no stable living quarters, because he continuously gives away his money or cleans out his own bank account and makes the money disappear. He has no way to manage his own money, and if a rep payee takes control, that's great, but they're still going to need to work on his skills, his hygiene, his clothing. The rep payee will have to make sure that he has proper clothing as well as a proper shave. They need somebody like me who was willing to put up with Raymond's bullshit. But see, they didn't want to work with me. No, they did not. They wanted to make fun of me for being disabled. You know, the help helping the help. That's why I was honest with them. I don't want any responsibility in this. I'm just helping. I'm just caregiving. Raymond is his own person. You guys said that both Raymond and David are independent. They aren't. They need a lot of care, but the state doesn't want to give it. So I'm giving the free care for these independent labeled people that can't even take care of themselves.